All right, we made it to my favorite species. Let's take a moment to enjoy this meeting. So I'm not a fan of the horse. I don't understand why they have a guttural pouch. It seems like a very bad idea. And is going to be a big topic of conversation today. All right, so influenza rules. We don't really worry about the horse as a reassortment host. So this is purely from a influenza. Oops. Don't drink in PowerPoint. So horse strains mostly come from avian strains. H3N8 is kind of the worry about. There has been transmission to dogs reported, but it's not like a back and forth reassortment thing. Just happens usually at tracks where both dogs. And yeah, all this is copy paste from other influenzas, including your own influenzas. Everybody get their shot. All right, herpes. Remember, necrotizing, ulcerative, subclinical latency, and disease with stress. So equine herpes 1 and 4, these are responsible for multiple syndromes. So there's an upper respiratory infection similar to red nose in cattle. It can also cause abortions. In neonates, you can get systemic disease. So that's kind of similar to Equine Herpesvirus, where it's multifocal systemic fibrosis in all your organs. Respiratory disease can occur at any age. It's usually pretty mild. It's most common in young animals. Importance of this predisposes you to bacterial infection, bacterial disease. This right here looks like a spinal cord. Is not. It's a trachea with a cast of mucosa. Remember we were talking about fibronecrotic membranes in the Motor Museum? There were whole casts of given intestines left out. That's what this is, but in the trachea. The whole tracheal mucosa has just come off as a clump. Blech. Very unusual for it to be that severe. PCR, don't do serology because everyone's affected by PCR. Equine herpes 5. So this is not an alpha herpes. It does not follow the alpha herpes rules of the gamma herpes. And they make their own rules. So it is a herpes, so it still does have a very high prevalence of infection. They are able to establish latency. However, unlike alpha herpes, these cause not necrotizing, but proliferative syndromes. So the example that we're going to talk about is equine multinodular pulmonary fibrosis, where it's not neoplastic, but it's like neoplastic-like, plastic-like, where it just causes massive proliferation of fibroblasts and huge areas of fibrosis in the lung. So some examples: Epstein-Barr virus in humans causes human lymphomas and carcinomas. Most of these are human and primate. Merit's disease in chickens is an alpha herpes, but it acts like a gamma herpes. So it causes those lymphoproliferative syndromes. This is an image of retroperitoneal fibromatosis in a non-human primate. It's caused by Hendra Virus, which is another gamma herpes. All right, so progressive interstitial fibrosis. Again, this is one that's going to be very slow, almost like a lentiviral picture. So this is going to be presenting in adults. They'll present kind of non-specifically, low-grade fever, weight loss, exercise intolerance, just kind of for viewers. Lesions on necropsy are going to be these variable-sized, multifocal to coalescing white firm nodules. In very severe cases, I've seen this coalesce so much that it becomes almost diffuse, and the lungs are almost diffusely fibrotic. There is a donkey form, asinine herpes 4 and 5, but primarily causes an interstitial pneumonia, and that's proliferative. Right, adenovirus. So this is another one that's part of the respiratory complex. Its primary importance is predisposes to bacterial pneumonia. Pneumonia due to this agent alone is rare and primarily goes with immunodeficiency. Hendra, this is another one that's not really emerging anymore. It has emerged in the 1990s, but similar picture to Nipah, so I kind of lump those together in my brain. Nipah is bats to pigs to people. Hendra is bats to horse to people. Very similar. This is an Australian disease. It's actually closely related to Nipah virus, so they're both Herpesvirus, but their target is a different species. The target of both of these is endothelium of your vessels. So these are both going to cause a lot of vasculitis. Rhodacoccus equi. So this is one that is related to TB. So I kind of lump those together. This is kind of mycobacteria-like, survives very well in the environment because it has that thick cell wall with a lot of lipids. So it'll survive in poo, dirt. This is an important cause of pneumonia and enteritis syndromes, primarily in foals. So less than 6 months. The pathogenesis depends on the route of exposure. So if it's inhaled, it's more likely to cause pneumonia. If it's ingested, it's more likely to cause an enteritis. Often some clinical, but clinical disease, if they become clinical, can lead to very high mortality if untreated. So treat them quick. Lesions. So this is, remember, related to myco. So it's going to be pyogranulomatous. It's not going to be suppurative. It's going to be a bronchodynaria. And depending on the route of infection, it might look a little different. So if it's inhaled, you might see a more cranioventral distribution. If it's GI, it can also go systemic and do like a metastatic or embolic lesion to the lungs. It can also infect the lymph nodes. So if you cut into the lymph nodes, they'll be very soft and oozy in the middle. Did you talk about Rhodacoccus and GI? Yes. At least one person heard you talk about Rhodacoccus and GI. So here's what that looks like. It's those raised kind of ulcerative and pyogranulomatous lesions. And then it can disseminate, so it can cause abscesses in other organs. Strangles, this is a pretty cool one. So this is acute presentation. It's highly contagious disease, again, in young horses. The reason it's called strangles is because it causes abscesses of these retropharyngeal and other regional lymph nodes. And then that mass effect actually closes the trachea, so they're like strangling. The fun thing about this is that those lymph nodes, they're filled with pus because it's strep, it's a pus former, and then they rupture to the outside and spill their pussiness everywhere else, so all their friends can get infected. That's like normal pathogenesis of the disease, to like rupture them out. You're like, pus for everyone. You get strangles, you get strangled. And they survive a lot in exudate, so that's important. Ugh. I'm going to make you all hate horses by the time I'm done. Impossible. Impossible. All right, what about this? Look how gross this is. So suppurative lymphadenitis complications are not uncommon. Strangles likes the guttural pouch. Here it is, full of cheese. Why is it even there? Tell me, horse people. What is this doing for the animal?
The reason for them to try and die.
Exactly. Not built for life. So this pus, it can become inspissated. Remember what that means? It dries out, you suck all the moisture back out of the pus, and it becomes like a cheesecake texture. In the guttural pouch, it can form cute little cheesecake bites. These are called condylets. They're little dehydrated pus rocks. Cool. Another fun thing I love about strangles is you can get bastard strangles, where you get these metastatic abscesses to places outside of the respiratory tract. So if it's in your lymph nodes, it's strangles. In your guttural pouch, it's strangles. If it's anywhere else, it's bastard strangles. Recurrent hemorrhagica. This is a very rare but very serious complication. This is immune complex vasculitis directed towards the bacterial M protein. And that's important because this is one of the things we test for when we're testing for the M protein. So vasculitis, you can get widespread edema, especially the head and limbs, petechia on the mucosa and serosa, and then an immune complex glomerulonephritis. So rare but very serious downstream complications that may persist after the infection is cleared. All right, Glanders, I'm not going to talk very much about because this is very old-timey disease. You do not see this unless you're working in bioterrorism because this is a select patient. So it's pyogranulomatous urticaria is one of those TB-like, Rhodacoccus-like things that causes pyogranulomatous inflammation. So here is, see how old this picture is? I had to work so hard to find any pictures of this disease. So this is a nasal cavity cross section like this, and we've ripped the nasal planum out of the way. So you can see turbinates and all these lumps here are pyogranulomas. Also causes a disease called RC, which is what this out of focus old-timey picture is illustrating. It's these chains of cutaneous ulcerating nodules that are tracking urolymphatics. So see why this is a select agent. I would not want this in my body. ERAO. So this is EUs or COPD. I believe this is the most current preferred terminology, but it has a lot of names. Pretty similar to human asthma. So it's the disease of bronchoconstriction, airway hyperresponsiveness, and excess mucus secretion and inflammation in lungs. Other problems, ethmoid hematoma. So the ethmoid terminates are here. In a horse, sometimes they bleed for no reason, and you get this big dangly. I don't want to say what it looks like. But you know, this dangly thing, and it flaps into the airway, and it causes a little bit of obstruction. And then exercise-induced pulmonary hemorrhage is common in athletes. It might impact performance, but it's not something they're usually going to die from. It's just going to be small bouts of hemorrhage. This chart, what's wrong with this, but hopefully your notes are fine. So this is for reference. This is kind of how I like to study for these. If I like to sort things by, I like to sort things in my head into categories, and that helps me remember. All right, enjoy that, and then done. Thank you.